Good evening, sir. And at the outset, let me thank GVK, sir, for this wonderful opportunity. This is a topic which I thought needs more, and I still don't have answers. Maybe at the end of the talk, I'll be expecting answers from this learned audience. So, moving on to the talk per se, I thought I'll just move on to what is circadian rhythm first, how it affects glucose tolerance, and already patients with diabetic, how the HbA1c is not under control, and then probably move on to the drugs. So as all of us know, circadian rhythm is a 24-hour internal clock that regulates our sleep-wake cycle, hormone release, metabolism, and other physiological process. As all of us know, it is controlled by the suprachiasmatic nucleus, and this is how the architecture of the circadian rhythm works. We have the Z givers, the external factors like your light exposure, food intake, sleep-wake cycle, physical activity, and all that, and the internal factors being your hormones. So, and we also have peripheral clocks everywhere. So, moving on to how it affects the insulin secretion. Insulin secretion and sensitivity, the time and day, again it is higher during the day, and as the day progresses the insulin sensitivity declines, and we have the pancreatic clock genes which has its own internal clock, and genes like clock and BMAL1 and PER, and all these control the insulin production, and also the meal timing, that is also a part of the circadian rhythm, so that also matters. Eating late night can have effect on the insulin secretion and sensitivity. Like that's what most of our teenagers and maybe most of our young IT professionals do, their meal timing and the pattern of work. They work for the US timing, and at home I see my son. So how it affects insulin secretion, again the meal timing does matter, and late night eating is linked to higher blood sugar levels and increased risk of insulin sensitivity. Slides are not moving. Slides are not moving. Yeah. And sleep, not to talk about the sleep disruption, again where you have poor sleep and irregular sleep patterns. Not only the young IT professionals, they also travel from one zone to another. So jet lag is another thing which needs to be seen also. So all this will only promote higher glucose levels and risk of metabolic disorders. And this is how the suprachiasmatic nucleus controls. If you see the parasympathetic, sympathetic nervous system, the pituitary, and all this, and your hormones are also controlled. And we see that an increase with the circadian rhythm. Again, we know that the suprachiasmatic nucleus controls all these hypothalamus pituitary axis and also the sleep-wake rhythm. And not only that, all this will increase your insulin sensitivity, whereas your melatonin, as we all know, that it starts secreting as the day goes by. So melatonin also has an influence on insulin, and cortisol, as we all know, it decreases the insulin sensitivity. And so to say what the circadian clock does and what the other peripheral clock does, we have peripheral clocks everywhere, like in the muscle, the pancreas, the white adipose tissue, and the gut, and also not to forget about the liver. So what does the effect of the circadian system on the metabolism of humans have? Yes, it does have an effect on glucose tolerance, and also your fasting glucose, maybe not, but yes, postprandial glucose, and also your postprandial insulin secretion. So all these are again influenced by your circadian rhythm and also by your HPA axis. So if you see this graph, we know that there is an impaired insulin sensitivity, impaired glucose tolerance, and also impaired beta cell function, which is seen in all these workers. So what does this amount to? So the effect of shift work on metabolic disorders, we know that they are prone for all metabolic disease, right from overweight and obesity, and also to increased cholesterol levels. And that is because of your disturbed circadian rhythm, poor quality and inconsistent sleep and digestive disturbances, all leading on, not to forget about the cognitive disturbance also. So we have umpteen number of studies, one by Neymar et al., which showed that there was an increased weight gain in the staff nurses working more on night shifts than on daytime shifts, and another study by Young et al., which again showed poorer control of diabetes associated with working night shifts. So we have umpteen number of studies to quote, and these are one more study by which showed that there is an increased HbA1c or a poor glycemic control, especially in patients working, type 2 diabetics patients working night shifts, and their average A1c levels was anytime higher than the workers working regular shift. So with all this in mind, and what would be the clinical implications? One is chronotherapy. Would we be able to give the medications on time? That is a big question mark. Again, their meal timing, especially all this is altered in shift workers. So the challenges we have is young IT professionals mostly glued to the screens. So we have a sedentary job, no time for working in between or any physical exercises. The timing of meals especially, because they have erratic timings, and I don't know, they snack a lot more than eating a whole meal, and sleep disruptions, yes. The timing of drugs, as I already said, and do they have any time for physical activity at all? So these are the issues that needs to be addressed when we talk about the staff nurses or the young IT professionals and the shift workers, even drivers who have to drive long journey, and as sir said, police people, and not to forget about our own population of doctors. So everything is a question mark, and we don't have a one size fit all for all this. We need to talk to them, chalk out their shift time, and then accordingly move on to the drugs. So one, I'll start with the meal planning. Again, meal planning needs to be done. You prioritize daytime eating and a balanced pre-shift meal. So this research suggests that consuming meals during daylight hours may help protect heart health, and also the pre-shift meal, a well-balanced pre-shift meal, again might have a good effect on their glycemic control. And consistent eating schedule, if possible, during the shift days, and also fiber-rich and whatever we generally give advice for any diabetic patients, and avoid heavy meals during the night and also post-shift. So that would also help. And healthy snacks, hydration, and avoid sugary and processed foods. All this is better easily said than done. We know that they all have an inclination to snack when we all sit and work at 12 o'clock, 1 o'clock. All of us have done night duties at Stretch. So all of us do still remember the 12 o'clock walk to the tea shop, go drink, snack something and come back. Maybe that needs to be avoided. I just thought I'll quote the study where this was done in healthy individuals, where they had simulated night shift in a control setting. This was done in Australia for about 6 days. 4 days a week they had the night shift, and 1 day was off for them. And they had given a balanced meal. They had divided them into 3 groups, where one was done for fasting, the other for a healthy snack, and a third group for eating. They found that OGTT done later on, the OGTT, as we know, that it had a better effect on people who were fasting and not snacking or having a proper meal in the night. Again, sleep and circadian rhythm. During the morning, what time can they sleep? That has to be charted out with them. And also this artificial light at night has a big role nowadays. That again has a effect on the melatonin secretion and on the leptin, thereby having a high appetite in the morning with the postprandial hyperglycemia. Not just the lights, the screens, our phone screens that we are glued to. So that also has an effect, and the more we are glued to the phones, the less the physical activity, and there we have the night eating syndrome and the fasting hyperglycemia. We see children nowadays looking at the phone with the blanket on top of them. We think they are sleeping, but no, they are looking at their phones. That we'll have to go tell them, you go to sleep. So that's what we do at home. So that again, so how do we incorporate physical activity in between? Maybe you can, instead of meal snacking, ask them to do a regular exercise snacking. So that might regulate their blood sugar. And hydration and stress management, yes. Sleep disruption again increases the stress level. So maybe yoga and breathing exercises. And how do we monitor blood sugars? Either SMBG at home or continuous. For young IT professionals who are affordable, maybe we can go for a continuous glucose monitoring, see what the real-time picture of real-time glucose and time and ranges, and accordingly have the drugs. So as I said, we don't have a one-size-fit-all here. If you're going for insulins, basal insulin will be better because it acts long, and bolus time insulin before pre-meal or whenever their shift is, we can time it accordingly. and insulin pumps for people who are type 1 diabetics or who are affordable, yes, go for insulin pumps. That would be a better option. I'm just discussing the options here. And as we all know, the medications would be metformin, DPP-4, GLP-1 analogs, SGLT2, and long-acting insulin. Metformin, as we know, it is weight neutral here, and it works consistently throughout the day and night, making it a stable option for night shift workers. And DPP-4, again, it helps regulate the post-meal glucose levels, which is useful for irregular eating patterns during their night shifts. And what about your GLP-1 analogs, which is much hyped about nowadays? Slow gastric emptying and promotes insulin secretion, and again, this again reduces post-meal glucose spikes, which can benefit for night shift workers who eat at unconventional hours. And SGLT2, when taken, again maintains stable glucose levels overnight, but hydration is very important. And long-acting insulin, as we have already discussed. So these are the options that we can give them when they need. Now, I just thought I'll just put 2 or 3 studies on this. We all know that tirzepatide is once weekly for treatment of obesity and again for diabetes. So night shift workers, if possible, this is just once a week, it might help them. And we know that it has also had a good effect on diabetes control also. So once a week, twice a week, step up the dosage. So this is one option. And SGLT2 this, and GLP-1 analogs is another option. And interestingly, this paper had this diagram where the SGLT2 also has circadian rhythm, maybe daytime action and an overnight action when taken once daily. This was very interesting, so I thought I'll just put it here. So morning, when there is a food ingested, we have your insulin and glucagon, insulin increase and a decrease in glucagon, whereas it is the other way in the night. So this is how your SGLT2 also acts maybe in the morning and its effects on the night also. So take home would be circadian disruptions will need to poor glycemic control. So all we don't have a one size fits all. So we need to have a precision management, talk to them, chalk out their schedules, and then go accordingly. And the one thing that we need to remember is avoid drugs that can cause hypoglycemia. Sulfonylureas, maybe Paneerselvam sir won't agree with me, but there are newer sulfonylureas which may not cause hypoglycemia. Thank you for the wonderful opportunity.
No,